Hello guys, welcome to our channel. This is Dr. Nawab Akhtar. Our topic is albinism. Albinism is a albinism is a recessive trait disorder that is normally inherited from two heterozygous parents. Let let look at here. Here autosomal recessive parents. Father is carrier, mother is also carrier. Like autosomal recessive means father is capital A small a and mother also capital A small a. So they produce four child. One son is unaffected, and daughter is carrier and son is also carrier, but one daughter is affected. Means here is unaffected means capital A, and here is carrier means capital A small a, and son also carrier capital A small a, and here is a means is affected. Means they produce four child. One child is unaffected, and one daughter is carrier, and one son is also carrier, but one daughter is affected. So it is autosomal recessive disorder. It is albinism is a congenital disorder characterized by the complete or partial absence of melanin pigment in the skin, hair, and eyes. Due to absence or defect of tyrosinase enzyme involved in the production of melanin. So due to absence or defect of tyrosinase enzymes involved in the production of melanin means here is tyrosine, it's converted into melanin with the help of tyrosinase. Due to absence means here absence means here tyrosinase is absence. Tyrosinase enzyme is absent means tyrosine is didn't convert into melanin pigment. So melanin pigment is responsible for skin color, hair color, and eyes also. So we will see the mechanism how to convert. Here is tyrosine is converted into 3,4 dihydroxyphenylalanine with the help of tyrosinase. Tyrosinase have copper, so with the help of oxygen and the release of H2O is converted into 3,4 dihydroxyphenylalanine, and phenylalanine is converted into dopaquinone with the help of again tyrosinase. Again O2 release into water, and dopaquinone is converted into non-enzymatic conditions. Non-enzymatic is converted into leukodopachrome, and here is in the presence of cysteine is converted into melanin polymerase. Melanin polymers, it's red. And leucotropa leucodropachrome is converted into 5,6 dihydroxinol. Dihydroxinol is converted into again with melanin polymers. It is black with the help of tyrosinase. Again oxygen is participate and release of water. So we will see tyrosine is converted into 3,4-dihydroxyphenylalanine with the help of tyrosinase. Tyrosinase have copper. With the help of copper, oxygen is with the help of oxygen, water is released and is converted into 3,4-dihydroxyphenylalanine. And phenylalanine is converted into dopaquinone. Dopaquinone with the help of again tyrosinase. Again same mechanism, and dopaquinone is converted into two parts. One is enzymatic and one is with the help of cytine. Non-enzymatic is leucodopachrome, and leucodopachrome is converted into 5,6 dihydroxinol, and dihydroxinol again converted into melanin polymerase. Melanin polymerase is a black color, and 5,6 dihydroxinol is converted into melanin polymerase with the help of tyrosinase. And dopaquinone is in the presence of cytine converted into melanin polymers. Melanin polymers is a red color. There is a clinical question. A 3-year-old child, intellectually disabled child, is having blue eyes, blonde hair, and fair skin. He also have peculiar body odor. What is the diagnosis? Last class we discussed about phenylketonuria. Phenylalanine is converted into tyrosine with the help of phenylalanine hydroxylase, and tyrosine is converted into melanin with the help of tyrosinase. If any defect in phenylalanine hydroxylase, so phenylalanine is didn't convert into tyrosine, it leads to the phenylketonuria. And tyrosine is not converted into melanin, so cause skin pigment defect in skin pigment, and eye also, and hair also. So diagnosis is phenylketonuria. Albinism is a albinism also called hypopigmentation. Hypopigmentation, acromia, achromasia, or achromatosis. What is albino? Albino means organism with complete absence of melanin. Organism with complete absence of melanins, it is albino. And albinoid or albinic. Albinoid and albinic means an organism with only a diminished amount of melanin. melanin, also called pigment. Melanin is a substance that gives the skin and hair its natural color. Reason for albinism. Reason for albinism. Sorry. Mutation in melanosomes. Pigment concentration controlled by alpha MSH, melanocyte stimulating hormones. Melanocyte stimulating hormones, it is a endogenous peptide hormones and neuropeptide of the melanocortin family. It's bind to the MR MCR1. MCR1 means melanocortin receptors. It binds, and they means alpha MSH is not bind to the MCR. Why not bind? Because of agouti protein. Agouti protein is inhibit the MSH binding with MCR1. So it leads to the mutation in melanosomes. And second one is mutation in the TRYP1 coding gene. Poor cellular environment for pigment synthesis. If we see symptoms, absence of color in the hair, iris of the eye, second symptom is lighter than normal skin and hair, patchy, missing skin color, crossed eyes, light sensitivity, photophobia. Light sensitivity means photophobia. Rapid eye movement, vision problems, functional blindness. Next to the diagnosis. Diagnosis is the albinism can first appear at birth because it is a physical deformity. that never changes. Detected at birth because of irregular pigmentation. Diagnosis is based on careful history of pigment development, and examination of the skin, hair, and eyes. The most accurate way to determine albinism is given test. Test is chronic villus sampling test. And amniocentesis can identify albinism during the second trimesters of pregnancy. And then we will move to the treatment. There is no cure for albinism because albinism is a genetic disorder. Treatment is limited. Treatment is only reduce the symptoms. The skin and eyes must be protected from the sun. The skin can be protected by using sunscreen. The skin can be protected by using sunscreen creams, and always wear special UV protective cloth. And children should receive annual skin assessments to screen for skin cancer or lesions that could be lead to the cancer. After skin, eyes. Many children will need to wear prescription of glass or lens, which can provide improvement in the vision. Wear dark glasses and eye muscle surgery is also do. Abnormal eye movement. 4. If we talk about the complication is the lack of skin pigmentations, making more susceptible to sunburns and skin cancers, blindness. And albinism may cause social problems because people with albinism look different from their families, peers, and other members of their ethnic groups. Thank you guys. Don't forget to subscribe, like, and share.